If you're struggling with elbow tendinitis or elbow pain, exercise is one of the foundational treatments for this problem, and it is absolutely necessary to be able to do exercises in order to get your elbow all the way better. On today's video, I'm going to show you exactly what to do with your exercise program to fix elbow tendinitis. Welcome back, everyone. I'm Burke. I'm a sports physical therapist in Bend, Oregon. If you're new to the channel, I provide detailed instructions on rehab, tips for recovery, and wisdom after 25 years of practice. If this is your first time here and you have elbow pain, I've done a number of videos already on the subject covering how to use the flex bar, which I'm going to show you later, secrets to rehab your elbow that most folks don't naturally think about and a physician probably isn't going to tell you, and other related topics. So be sure and check out the links in the description. So elbow tendinitis can be very stubborn. That's because this is an overuse injury, and an overuse injury means that we have disrupted all the little fibers that make up the muscle and tendon, and those fibers are trying to heal. And as they try to heal, our body grows new blood vessels and new nerves to that tissue, and that's what makes it so sensitive and so stubborn, because we're building this new network of capillaries and nerves, and it's not going to go away overnight. Often this is a problem that has taken maybe weeks or months to develop, and so it's going to require some time to get better, and it's going to require a combination of approaches, including some smart bracing, which I have a video on that you can check out, modifying your activities, which is probably one of the hardest things that folks face when they're working on fixing this problem, and then having a really good exercise program. It's essential that you actually put some load through those new fibers, those healing fibers, to help guide your body in how to heal them well and to stimulate that kind of healing, that kind of positive growth that we want. So the exercises have to be the right intensity for you. If you're watching this video, you're either very proactive and you've had maybe a scare of an elbow problem, or more likely you've been suffering with this for some time. Your elbow is really sore, it's probably really inflamed, and you're going to have to ease into these exercises more slowly. So to do this exercise program, you're just going to need a few things. You're going to need a squishy foam block or squeeze ball of some kind, or putty. You're going to need a couple of different small weights. I have a 1 pound and a 2 pound there. You'll need a little stretchy band, and then you're going to need a flex bar, which is one of these. So elbow problems come in two flavors, an inside of the elbow flavor and an outside of the elbow flavor. And those are caused by forces in opposite directions, essentially. So you might have either of these. The good news is you can actually do this entire program for both sides of your elbow, and it will be beneficial. If you want to be more specific, I'll tell you as we go along which side we're treating. But don't be afraid to do both. Really, it is helpful to condition your elbow in all directions through all planes of movement. First thing we're going to do is a stretch, and I'm going to start with my arm straight out in front of me with my wrist down like this, and I'm going to bend my wrist, and at this point I am stretching my lateral epicondyle. I'm actually stretching all the tissues on the back of my forearm, which merge into that important tendon. So this is our first stretch. You can vary the angle that you do this in. Sometimes if I'm sitting in a chair and I've been typing for a long time and I'm starting to feel tight, I'll actually bend my wrist like this and I'll sit on my hand and I'll just gently lean away from it. I'm pinning my hand with my body, and that provides a really nice forearm stretch. Hold this for about 4 or 5 seconds. Do this 4 times a day. If you're having pain on the inside of your elbow, you're going to do the opposite. You're going to extend your wrist like this and straighten your arm all the way. If you're very tight, if these muscles are very tight, this may be a little bit difficult at first. Be patient, take some days or weeks to work all the way deeper into the stretch. Same timing, 4 times a day, hold 4 or 5 seconds. Do maybe 3 to 5 repetitions. Next, we're going to use our little weights. I have a 1 pounder and a 2 pounder. Start with the 1 pounder, hold the 1 pounder, rest your forearm on something, okay? This could be the arm of a chair, it could be a counter. I'm just gonna use my other hand to demonstrate. And extend your wrist like this. This is for lateral epicondylitis or the outside problem. And then I'm going to extend and slowly return to neutral in the first phase. If the first phase goes well, I can slowly drop my wrist off the edge of the chair, armrest, or counter. And then for the final third stage, of course, you'll probably have graduated in intensity of weight. You're gonna do this with your elbow bent and your arm off of the surface, and then progress to partially bent, same move, and then all the way straight, same move coming down. This is the hardest position for this problem when the arm is all the way straight. It tends to just put the most load on that tendon. So we're gonna start with elbow bent, then partially bent, and then straight. That's our stage 1, 2, and 3 progression. Here's a tip. If your elbows are very spicy, meaning they're pretty sore, start without using any weight at all. Just go through these stages, elbow bent 90 degrees, partially bent, and then straight. Just do this without any weight at all, just to get your body used to activating without any extra resistance. Once you can do 2 consecutive days of that, start with a little 1 pounder, and then once you can do 3 to 5 days with the 1 pounder without any increased symptoms, graduate up to the 2 pounder. To get the inside of the elbow, we're going to do the exact same move, but flipped over. So I still have my 1 pounder, or in fact, we'll start without any weight at all. I have my elbow bent 90 degrees, and I'm just going to activate that muscle without any resistance. And then I can slowly release. Same thing, we're gonna start with 20 reps, work up to 30 reps over the first few days. If you're tolerating it well, add your 1 pounder. Same thing, slowly reverse, progress to your 2 pounder, and then progress into your different angles all the way straight. This is going to be the hardest. For this next exercise, these elbow muscles are also responsible for rotation. And actually that can be a trigger for a lot of folks to have this problem, especially our racket sport players or people who use their arms for industry, working with wood, working with metal, doing manual labor, etc. There's often a twisting component. And so to get that, we're gonna take our same weight, hold at that same 90-degree angle, and this time I'm going to rotate back and forth like this. Same progression, folks. Once you can do it with your elbow at 90, straighten your arms somewhat, and then all the way. And once that gets easy, give yourself a little bit of extra torque, extra leverage, and progress in resistance to that 2 or even 3 pound weight. Next, we're going to work on grip strength. And I have this little foam block right here. A lot of folks will have like a stress ball. Often in physical therapy, we'll use putty like Play-Doh. But these are pretty easy to find. And I'm just going to squeeze. Same drill. Start elbow at 90. Progress partially straight. Progress all the way straight 10 times a day, once a day, squeezing the foam or stress ball, whatever it is that you have. Next, we're going to take our little band, and you can use a rubber band if you don't have some of this. This is very common in physical therapy. This is called, the one brand is TheraBand. There are others. Doesn't really matter because it's not rocket science. I'm going to wrap this over my fingers, and I'm going to stretch my fingers apart. Okay, so this move right here is stretching your fingers apart. Get my little pinky in there. So far, so good. If you're still with me, we're graduating to the flex bar. This is called a flex bar. I have a pretty detailed video on this. So what I'm going to show you very quickly are a few of the key exercises to do with the flex bar. The flex bar, if I'm doing this for the outside of my elbow, I'm going to start in that shortened position, and I'm going to take my other hand over the top, wind it up so you can see that there's now a twist in that flex bar. And then I'm going to straighten out, and you can see that I'm starting with wrist extension, and I'm going to slowly release into that resistance. This is forcing me to use this muscle while it's lengthening, which is going to help remodel that painful tissue. So this is called a Tyler's twist. Again, start with your wrist cocked like this in extension, wrap your hand over and twist away from yourself, straighten out and release. If you have a problem on the inside of your elbow, it's exactly the opposite. I'm going to slide this down. I'm going to flex or curl, come in with my other hand like this, and then now I can release like so. So even though I'm extending, I'm using the muscles that are painful and involved. Those are two key moves that you can do with the flex bar. Another one that you can do is called bread breaking, and this is like the rotation that we did with a little dumbbell. I can bread break this way. I can bread break this way. I can also rest this on something like a counter and then just work on one arm at a time. Okay. We're going to start with 15 repetitions of that move, one time a day. If that goes well, you can bump it up to 20, 25, even 30 repetitions. What we're trying to do is we're trying to stimulate chemical things to happen in that painful tissue. So this is stress that you're applying, but it's very specific stress, because even though you're doing 20 or 30 repetitions, you're not doing hours on a computer or a mouse or a jackhammer or a nail gun or whatever, or a guitar, whatever it is that you do with high repetition over a lot of time. 10, 15, 30 reps is nothing compared to that. And so aim to have kind of high intensity with this. Intensity needs to be a little bit high because we need to trigger a reaction in your body. So if you're sensitive, this would be a good time to make sure you're combining treatments. Another treatment would be using the right kind of brace. Another might be getting some medical support from a physician. But make sure that exercise is part of your strategy for working on this problem, and give this about 4 to 8 weeks to work. It's not going to happen overnight. So do you have other tips and tricks or discoveries that you've made that have helped your elbow? Please drop them in the comment section below. As always, thanks for joining me, and I will see you next time.